The Wake County Emergency Medical Service, better known as Wake EMS, continues to lead the country in the area of rapid response of medical emergencies with a myriad of innovative and advanced paramedic practices. But the department is now improving the way it responds and assists mental health and substance abuse patients. Joining us to talk about the latest news involving Wake EMS is Jeffrey Hammerstein, District Chief for Wake EMS. Thank you so much for being here.
Thank you, Eric. Glad to be here.
There's a lot of discussion in recent years about mental health care across this county, across the state, and across the nation. Does EMS come in contact with this population often?
Eric, absolutely. Up to 700 times or so a year, we come across persons who may be suffering some type of mental health crisis. Oftentimes we respond along with law enforcement. Both law enforcement and EMS have made great strides in recent years in figuring out better ways to deal with people who may be suffering a mental health crisis. In older times, there were fewer options. Law enforcement may have the option to take someone to jail. Well, that's not the place that they need to be in many cases. The EMS option, if that other side didn't work out, was just to take someone to a hospital emergency department. Now, when they go to a hospital emergency department, they will eventually get to the right type of treatment facility where they need to get the most help. The problem is our emergency departments here and across the nation are crowded. They prioritize who they see based on the urgency of the medical need itself. And for our folks in mental health crisis, the medical side is not necessarily so urgent. As a result, they end up spending a lot of time, sometimes on average up to 14 or more hours, waiting to eventually get transferred to the right place. We feel like we can do better than that. With an EMS response to these mental health crisis situations, we can go and have a paramedic do an evaluation of that person. If there is an immediate medical need, we'll still get them to the emergency department. However, if there's not, in many cases there's not, we can bypass the emergency department and work on getting them straight to a facility that offers more appropriate care. By a long shot, it's better for them. I think it's difficult for anyone to spend a long time waiting in any type of waiting room to finally get the care that you need. But if we can get them there, that saves them that time. It reduces overall cost for what they would spend in the emergency department for the simple evaluation itself and whatever they may need. And we get them straight over there and they get the care that they need there.
What treatment options does EMS offer for someone suffering a mental health crisis?
More than anything, it's the evaluation and determination with our partners across the area of where this person needs to get and can we offer them those services. One of the things that makes that difficult, historically, EMS is only reimbursed by insurance, Medicaid, Medicare for taking people to an emergency department. That means some resources have to be used if we're going to figure out ways to get people to the right place rather than the emergency department. EMS is kind of going out on a limb in that sense financially. So we have to be responsible with that, and we have to look for ways we can make that work and be sustainable. One of the things we've been talking about this spring with state legislators is figuring out ways to allow Medicaid rule changes to where EMS can be reimbursed for getting people to the right place. Not only is that by far the best thing for that individual person, but it also lowers overall Medicaid costs because they're not spending that time in the emergency department. The transport to the other facility is cheaper on our end. It certainly saves that hospital cost, and it ends up being better for everyone.
The issue of Medicaid and how to really reform the practice of Medicaid and getting the services to those who need it the most is something that continues to be a discussion on the federal, state, and local levels. This program, though, kind of highlights at least one small but important example of how this could really work in that scheme of changing the way we think of Medicaid.
Absolutely, and EMS service delivery across the board and across the nation. Again, traditionally, EMS has only been compensated, whether by Medicaid, Medicare, or insurance, for taking people to a hospital emergency room. As time goes by, we learn more and more. We know there are more efficient places for certain patient types to get folks to. We feel like we can help reduce healthcare costs by getting people to the right place. It's more efficient. It's better for the patient, it makes for a healthier population, it makes the patient more satisfied, and that's the triple aim that we're all working for in healthcare. The issue on the local, state, and federal level is organizing payment structures such that EMS can be compensated for getting people to the right place, other than just the emergency department when that's appropriate, so that those systems, those resources can be sustainable by the funding received in exchange for that.
Okay. Jeffrey Hammerstein, District Chief for Wake EMS, thank you so much for being here.
Glad to be here.